people think that a person with disability cannot get HIV. We can't have children. Many disabled women are dying because of failing to get testing and counseling.
Zambia has made great progress in providing HIV care and treatment. However, the almost 2 million people with disabilities face a number of barriers in accessing HIV services. They're often left out in terms of access to prevention, access to testing, and access to treatment and care.
My first husband transmitted to me this HIV. I started falling sick. I went to the hospital to be tested. There at the hospital, I found the doctor who had difficulties in communicating to me. He was just writing.
There is a perception that people with disabilities don't need access to HIV services because they don't lead full sexual and reproductive lives. In reality, they're more vulnerable to HIV. Women with disabilities are also exposed to higher levels of intimate partner violence and are less able to negotiate safe sex practices within their relationship. Girls with disabilities are often not protected and are taken advantage of.
As a girl child with disability, you are excluded from accessing information on sex, information on what to do when you're getting married, or how to bear children.
Never walked into a counselor's office to be counseled how to live with HIV. Soon you tell someone I'm HIV positive, they think you got it through sexual activities. They don't realize that you can get it through mother-child transmission, which is my case.
We know that children in general have less ability to access HIV services and care, and we know that children with disability are even more vulnerable.
The access to information about HIV and AIDS among persons with disabilities in general is quite low. The information is usually not presented in the formats that are accessible to disabled persons, more especially those that have sensory disabilities, like the deaf and the blind.
For deaf people, when they're accessing HIV testing, confidentiality is a key concern. Often enough, the HIV testing counselor won't know sign language, so there needs to be a third person in the room, whether that's a friend or a family member or a sign language interpreter. And by having a third person in the room, there is a loss of confidentiality. So there needs to be accommodations for people with disabilities, such as access to sign language interpreters who have ethics training and know how to preserve confidentiality.
The most challenges that we are facing, especially on those patients that are deaf, those that do not even know how to write or read, and they only know this sign language, it will be very, very difficult for me to give the correct information to this client or get any questions that they are trying to put across to me.
Deaf people are not aware about HIV/AIDS because they lack the sense of hearing, while there is wide publicity about HIV/AIDS among the hearing community. To begin with, interpretation services are not readily available for them. So what do? They just remain in ignorance.
Once people with disabilities are diagnosed with HIV, just as like everybody else, they have to attend periodic appointments where they receive counseling and ongoing management of their treatment. But for people with disabilities, it's very difficult. Often they have to either pull their child out of school or somebody in the family has to take time off work to accompany them.
When I go to clinic, you are going to find that I must go with my guider. I can't go alone there as a blind person. So we are going to find that if you are given an appointment, then you miss that appointment, you are going to find that they are going to give you like something like a default, whereby if you got medicine for 3 months, they are going to reduce maybe for 2 weeks.
They are mainly focused for the able-bodied and not the blind people. Recognizing what tablets you're actually holding, the box itself, it's in ink print. Yeah, there's no kind of tactile braille features on it that can tell you that this is lamivudine or this is fluconazole or this is what tablet or that tablet.
So the Zambian government recognized that people with disabilities are vulnerable to HIV. However, on the ground, it has not been able to deliver services to people with disabilities. There is tremendous donor support for HIV programs in Zambia, and what's critical is that international donors that are supporting the HIV response in Zambia ensure that those funds are directed towards persons with disabilities.
Even if the clinics are not user-friendly, you have to go to the clinic so that you test yourself, you know your status. You have to force yourself, even crowing, so that the government can see that the clinics are not user-friendly.